guys, this is me Gayatri Akil and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So here I would like to discuss with you all about 2nd of September 2023 OET exam writing as well as speaking. So let's move on to the topic. So there was a two case notes. One is known case and another one was an unknown case. So what was the known case letter? The known case letter was like writing a letter to a GP, so by a community nurse. Okay. And the second letter is an unknown case letter. So here we are writing a letter to the rehabilitation center for the rehabilitative management and care for the patient. Okay, so now we are moving to the unknown case letter briefly. So here patient got admitted in the hospital because of the fall at home and ended up with the signs and symptoms of stroke. So once the patient arrived to the hospital, they have done an MRI to the patient. In the MRI, they came to know that patient is having ischemic stroke. So patient was transferred to ICU and she was treated there, and she was initiated with the physiotherapy, occupational therapist, and patient was encouraged to mobilize. However, the patient was resistant to walk because she was fear of getting fall again. And apart from that, she was received pain relievers, blood thinners for her condition. And here the family meeting was held and the family was explained about the rehabilitation care and management to go for her transitional care. And then the family got accepted. So the patient is going to rehabilitation center. So in the rehabilitation center, we are explaining to them as a discharge advice, continue the medications because she has depression, hypertension, and she is on medication for the same. So that we are advising them, the patient to be continued with the same medication, whatever the medication patient is on. Second thing, continue the physiotherapy, provide full assistance for her activities of daily living, and also she is on speech therapy, so that also has to be continued. So it was a very simple letter, and this is the letter this is the information that we are writing to the rehabilitation center because which are the important informations. Okay, so as usual, how you can write this letter? So writing the date on the top of the letter, and then you are writing the addressing person address, and then salutation, and you are coming to the point of reference and date of birth or the age of the patient. In the introduction, we can start. So I'm writing to inform you regarding so and so, either patient male or female, because I'm not sure with that. So these are the information which I have gathered from my students. So I got only these kind of informations because there were two letters, so I got just here and there from my students. Okay, so you are writing, I am writing to inform you regarding Mr. or Miss, the patient name you are writing, and then you are writing the condition is who has been treated for stroke, ischemic stroke, full stop. She needs your rehabilitative care and management because we are sending the patient to the rehabilitation center because she needs to go back to her home after the rehabilitation center because she needs the transitions, right? So for the rehabilitation center is the one can help her to bring back her normal activities from the stroke. Okay, so this is a way you are writing the introduction, and then you are writing the present medical history paragraph. In the present medical history paragraph, you will write since the date of admission to until the discharge, what was the treatment was given to the patient, how the patient was reacted to the treatment. So patient was admitted to the hospital so and so date following a fall at home. Therefore, she has taken for an MRI which revealed ischemic stroke. Then you can write as a result of that, she received blood thinners and initiated with the physiotherapy, speech therapist. Along with that, she was encouraged to walk. However, the patient was resistant to walk due to fear of fall. And then a family meeting was held as patient showed good progress in her condition. A family meeting was held and was explaining about the importance of rehabilitation. The family was finally agreed and the patient is being discharged to rehabilitation center on this day. So this is a present medical history paragraph. And then coming to the past medical history or social background. So the patient was a driver, and patient what all the habits and what is the main patient's past medical history was patient was a hypertensive patient and patient was treating for the depression, and the patient was on medication for the same. That all those things has to be explained one by one in the social background paragraph. Now recommendation paragraph, what they exactly do. So it would be appreciated if you could continue her medications as prescribed. Second thing, kindly continue the physiotherapy as she received at hospital along with the speech therapy. and it would be like you can say it would be highly beneficial if she received assistance for her activities of daily living. Full stop. Then please contact us for further contact me for further details, and your sincerely or your faithfully, if the addressing person name given, sincerely, if not given, faithfully. So you are completing the letter. So it is a very simple letter. If you are picking the information which is necessary for the rehabilitation center people to know it, that is more than enough. Remaining all, it's not necessary to write it in your letter. Okay, this is the unknown case letter which you are writing a letter to a rehabilitation center. Okay, now coming to the point of your known case letter. So here I said like it is a letter we are writing to the patient's GP. So what happened? Patient name was Anne, and she is 70 years old, and then she was suffering with the lymphedema. So what it was happening, a community nurse was doing the home visit for the patient, and then she was visiting the patient at the first time, and the patient was complaining about wound discomfortness and the pain. So the nurse has done the dressing, and also she provided the pain reliever as prescribed. And then when she gone for the second visit, patient was much better and patient was much comfortable. And then third time when she gone, the final visit, patient was again complaining of discomfortness of the wound, and patient was complaining of the pain. So the nurse, what she has done, she has taken the wound swab for the culture, and then she is writing a letter to the patient's GP, so and so reasons, and patient needs to be looked after by yourself for lymphedema. So that we are writing a letter now. So as usual, we are writing the date of the letter on the top of the paper, and then addressing person, and then salutations, and then we are coming to the introduction. So in the introduction, as it is a known case letter, we can start like that. I am writing to inform you regarding the current health condition of Ms. Anne, who is who is suffering with the wound discomfortness. Otherwise you can write who has lymphedema. Full stop. She needs your further treatment and management after her wound culture report, or else like that, she needs your urgent treatment and management for her current health condition, like that we can write. Then coming to the present medical history paragraph, this has to be elaborated as much as possible, as we are not writing a social background and past medical history of the patient, because why, it is a known case letter. The GP is already looking after her for such a long years, and he knows that what is her past medical history and what is her medication history and how about her social background. So that is unnecessary for writing to a known case to the known person. Okay, so here present medical history. So during the first visit, otherwise you can start, Ms. Anne has been under my home visit since this many days. During my first home visit, Anne has complained of wound discomfortness and pain. Therefore she was redressed the wound. Therefore her wound was redressed and then provided with the prescribed and advised us to take prescribed pain relievers. Then during her second visit, she was much better, and she was relieved from the pain and the discomfortness. During the today's visit, she has complained again regarding the discomfortness of the wound and also pain, and the wound swab culture was sent for the treatment and management. Then you are writing the recommendations, like, because here we are skipping the social background, right? So again we are coming to the discharge advice, like not a discharge, it's a kind of a recommendation. So it would be highly appreciated if you could look after Anne and treat her condition as you feel appropriate, like that you can write your concern on her condition is immensely appreciated. Then you are writing the conclusion, like, thanks for please contact me for further details, and then you are sincerely or faithfully as per the addressing persons. Okay, so this is the way the both letter has to be written. That this is kind of a way we are writing a letters. Okay, because only we are just picking the important information from the case notes, not writing all the informations unnecessarily. So as per the receiver, what they must to know, that is the information is more than enough to write it in the letter. Okay, so next move on to the speaking topic. So what all the topics has been asked during the exam time? So the topic number 1 was, like here, the suburban clinic here, urinary incontinency. So here the mother is suffering with the urinary incontinency. So the son was educated regarding how to look after the mother and how we can help her from the urinary incontinency. So that was a pure health education to the son, who is worrying about the mother who is suffering with the urinary incontinency. So they have visited the suburban clinic. So there he got the education regarding that. And second one is a home visit. So home visit, here we are just explaining about the hernia repair management. So what is the hernia repair management? Regarding that, we are just doing the home visit. The patient who has undergone already hernia repair, so what was the education they have given. And then second one is hospital ward. In the hospital ward, it was education about the catheter removal. So why it is necessary to remove the catheter and what is the benefits of doing that one and the importance of that one. Everything has been explained. And then the last one is another one is community health center. So regarding the smoking cessation education. And then the last one is school health nurse. So she is giving education regarding the head lice of the baby. So overall the speaking was really good, and the writing and also it was overall good because the case notes was not that much tough, and there was an information which is enough to write it, and also we can pick the appropriate information for the both the receivers. Okay, I hope you all have done in a very good way, and if you would like to join in our class, we have 40 days, 60 days and 20 days and 10 days crash course also going on, and also we are taking separate classes for writing and speaking. So whomever is interested to join in our class, our number has given in our description. You can contact us at any time. So until then, bye bye.